As I shared in my opening, we are doing our best to offer multiple ways to have active participation in our meetings. Thank you for the contributions in chat through our Q&A. We know that there are many perspectives and voices that we want to be able to hear from, but time can be such a limiting factor for us. So during our registration for this meeting, we did invite those of you who may have wanted to offer a 2-minute reflection during our public response period. And that is now where we are at in our meeting. So we have a number of individuals who have requested to share their reflections around the conversations of engaging and elevating the community perspective. And so I'll be calling on each of you one by one to join us and offer your 2-minute reflection. I'll first turn to Deborah Dalda, who's a PhD student at UMass Boston and the UCSF Community Engagement Research Incubator and Strategy Hub.
Thank you so much, Ivory, for this opportunity, and hello, everyone. I'm so happy to be here today. I wanted to talk briefly about the work that is being done at UCSF. So I am part of 21 people who are serving as a Community Advisory Council member for the UCSF COVID-19 Priority Research Study. And Priority stands for Pregnancy Coronavirus Outcome Registry. It is a nationwide study that is investigating the impact of COVID-19 on pregnant and birthing peoples, as well as their newborns. However, as we all know, prior to COVID-19 outbreak, there's been a Black maternal health crisis in this country, where Black women are 3 to 4 times more likely to die during childbirth and from birth-related complications compared to white women. So in this context of the ongoing Black maternal and child health crisis in this country and COVID-19, the Priority Study is harnessing opportunities to advance health equity, social justice, and racial equity by implementing a community engagement framework, which is the CAC, which it's organically informs the generation of culturally responsive research questions, recruitment strategies, and educational materials for BIPOC communities in order to kind of identify the particular impact the virus has on this community who have the capacity for pregnancy. The Community Advisory Council itself is model is led by the Reproductive Health Equity and Birth Justice Core of the Priority Research Project, which works to ensure that there's data integrity and the full participation of people experiencing the greatest burden. So in terms of how we can harness racial equity and also opportunities to advance health equity, the first thing I want to mention is, listening to the narratives, stories, and experiences of folks who are closest to the issue that we seek to address. We need to answer questions very honestly, and we need to also show up and meet folks where they are. And this means, doing this physically, I understand in terms of COVID, but also figuratively as well. And it is so important that we also engage communities in research from the beginning, meaning that in the line item of community engagement, should not be like when we're applying for grants and such, like when we're trying to think about this kind of work, our line item for community engagement work should be embedded in all aspects of the grant proposal, and it should not come as an afterthought. We also need to pay communities, and I'm so happy that this was mentioned earlier during with another panelist. I think Rashad, you mentioned that about paying young people for their contribution and in their intellectual property. So we need to pay community members for their engagement in projects. The Priority CAC, for example, are compensated for the work that we do on the council. And it is also the dignified thing to do. It's a respectful thing to do. So in order to advance health equity and racial justice, we also need to invest in the future workforce to carry on this necessary work. And we also need to create pathways for the social and economic mobility of young people, particularly from BIPOC communities in this type of work. We can do this through functional education, through mentorship, and also through employment. Finally, I want to talk about my current frustration with this, in this current system, which centers around folks, particularly folks who are in power, centers around people who are in position of power, particularly white people who hold on to power and have no concrete solution in addressing health inequities and are not creating spaces and avenues for folks who actually have the experience, the lived experience and the expertise to address the health disparities. And this is why community engagement work is particularly important, because it can help us break this vicious cycle and the asymmetry of power in research and clinical practice. Thank you so much for listening.
Thank you, Ms. Dalda. I'll turn to Julia Chalenor, an Associate Adjunct Professor of Nursing at the University of California, San Francisco. Professor Chalenor.
Thank you so much, Ivory. What a pleasure to be here and listen to this really terrific presentation by the group earlier and the leadership from Rebecca at NAFU. I wanted to also pick up with what Deborah Dalda and what Rashad said initially about being paid for expertise and lived experience. And I was really amazed. I attended with the WHO Director General, held a community conversation with, it's called NCD Child, but it means non-communicable diseases, but it's the actual acronym is NCD Child is how you find it on the internet. And it was a group of youth. It was on October 2nd. I hope it was recorded because it was a very powerful conversation with Dr. Tedros. And the title was Promoting the Health and Well-Being of Young People During the COVID-19 Pandemic, but leveraging youth engagement and participatory governance. And one of the things they got up and said was that they needed to start getting paid, and they didn't just want a seat at the table so people could check a box and said, we had a youth at the table, now we move forward. And not only that they didn't just want to be paid, but they wanted somebody to take action on what they were actually saying. And I've listened to several of these conversations that the Director General had, and I never saw him as animated as when he was talking to this youth. In fact, when they were done after the hour and a half, he said that he was so impressed by what they had told him. And they came from everywhere. They came from the Caribbean. They came from the Eastern Europe. There was a set of them, about 5 or 6. He said he wanted a second one to be set up because they had further discussion to have. So if anyone feels that your voice is not being heard at a federal level, and all my work is overseas, so I don't know a whole lot about the federal level in the United States. I also lived overseas for 14 years. And so my work is really international and only in low and middle income countries. But it woke me up to the fact that we need to start, in my work, I work with children with cancer and nurses who take care of them across low and middle income countries. We need to start listening to the youth, bringing them to the table, remunerating them for their expertise, and then more importantly, taking action on what they tell us. Because I think we fight as nurses to get our voices heard in healthcare. We're not always the first group that people turn to, but boy, young nurses, young patients, adolescents and young adults with cancer or who have survived cancer have a lot to teach us that we can learn from. So I really salute all of you and thank you for the opportunity to share my thoughts and reflections.
Thank you, Professor Chalenor. I'll turn now to Ilioma Ho Lasimo from the Waimanalo Learning Center and Ke Kulua Nui O. I apologize if I have butchered that name, but please do correct me.
Ilioma Ho Lasimo sa Waimanalo Learning Center and Ke Kulua Nui O Waimanalo. So Ke Kulua Nui O Waimanalo is a nonprofit organization that we started a few years ago, and very different from most nonprofits because our president just made 25. And he is raised in our community of Waimanalo. And I like what was said about paying our kids for getting their information across and sharing the input and expertise. We try to do the same, and we try to give them opportunities to lead and be the power, be the information, because they are the future. And what happened in our community, I think, is a good example, is many times our kupuna, our elderly who run these organizations, take it to their grave. They take the power to their grave, and we don't have a contingency plan, how we're going to continue, how we're going to make things work for future generations, because it's lost with the person that goes and takes all the power with them. So changing the narrative and making the kids, the youth, in my opinion, be the leaders is the best way to transition and have cohesion moving forward. And you know, our youngest leader, he's 15 now, takes charge of a lot of initiatives, and I love to see it, and I love to be able to pay them. And a lot of times adults don't understand the value of their input. So I'm so glad to hear what you guys are talking about with the youth and engaging them with funding and opportunities that matter to them, because a lot of times adults are only thinking about what they need and what their, issues, initiatives, opportunities are. So if we give the kids the lead and give them the opportunity to lead with their ideas, I think we're in a good place. And that's where change is going to happen on the ground level. As Hawaiians, as Kanaka, as people of Hawaii, we are like everyone else, displaced in our own homes, in our own Aina, our land is not belonging to us. And so we're at a disadvantage as far as health, as far as education, all of those things. I too am first time educated in college, but I went to school when I was 42, when my children were getting ready to go to college. And it's a very different dynamic and it's a lot of learning, but it wasn't part of the game as far as education for us, really. It was go to work so you can help your family at a young age. After high school, you're lucky to finish high school and then it's time for you to move on and go to work because you need money and your family needs help. So changing the narrative, teaching our kids that it's important to get a college degree is a lot of the issues that we are trying to work with, and getting them to start earlier with dual degrees with high school and college at the same time is things that we're trying to teach them so that they're not lost when they graduate from high school and don't know where to go, left, right, or straight. So mahalo for the opportunity. Good to hear all of you, and thank you for your great work. Mahalo. Aloha.
Thank you. And I'll turn to Mary Michaels, who's from the Public Health Prevention, who is the Public Health Prevention Coordinator for the City of Sioux Falls, South Dakota's Health Department. Ms. Michaels?
Hi, everybody. Thank you so much for this opportunity. It's been a great conversation. My perspective really comes from the local level. I work in city government. Here in South Dakota, we only have one local health department in our entire state, and it's here in Sioux Falls. So we are part of city government, not attached to our state Department of Health. And, you know, for all of the negative impacts of COVID, the one thing that kind of gives me hope is the light that it has really shown on, you know, where we do have inequities in our community, where we do have challenges, and really forcing us to think about the work that we do in a very different way. I mean, from how we deliver services when people aren't coming out. You know, we didn't have a formal lockdown. We had some city resolutions that our council put in place to try to limit gatherings, and we did close some public access to city buildings for a time, but we still had to figure out a way for people to access our services. And so it gives us this opportunity, as long as we're thinking about doing work differently because of COVID, how do we continue to do work differently in the way we engage our community? And one of the projects that I've had the opportunity to be part of, we have our mayor, when he came into office a couple of years ago, started a leadership program where employees are nominated, but they're nominated by a director other than their own department director. So you're nominated by a director from another department. And it gives us this opportunity to work with, you know, other city employees that we would never have the opportunity to work with really on our day-to-day basis, and to think about what does the city need right now, and to propose projects that the city should explore. And the project that I pitched that happened to get selected was, how do we really more formally think about that culture of health and that approach to health equity? And what we've developed is a framework for decision making. You know, how do we help somebody working at the city landfill think about health equity? I mean, health equity cannot just be the responsibility of the health professional anymore. It has to be the business sector, the education sector, the faith community. I mean, all of us working together. So how do we help our colleagues at the city in their day-to-day decision making get beyond the we've always done it this way, to think about who's impacted by my decision? Who can I partner with either at the city or out in the community, and think about approaching this work in a different way? You know, it's very early in the stages, but I think that's something that is so important, that, you know, a lot of people who are working in academia and working in public health talk about this all the time, but people who are, you know, engineers and build streets and are planning neighborhoods and are, you know, working in parks and rec don't necessarily talk that same language. So how do we really take this concept of health equity and make it real for them and say, when you make this decision, this is the potential impact? And so, you know, I think that's something that we need to continue finding ways to gather those stories and share stories so that, we really put it in plain language and say, okay, on a day-to-day basis, this is how we can engage our community in a real and meaningful way.
Thank you, Ms. Michaels, for those reflections. And thank you to our other public respondents for sharing your reflections on the importance and understanding what is truly needed to engage the lived experience and voices, particularly that of youth, and then to think critically about really taking action on what is being said and shared with us. So thank you to our public respondents. Thank you again to our panelists, and thank you to all of you who have joined us in our conversation today and over the last 3 days to identify the challenges as well as our priorities for community-driven efforts to advance health equity. As I mentioned earlier, these meetings will be recorded and we will upload them to our website. Before we close out, I want to thank again my colleagues, Julie Tarrant and Stephen Chukwurua, who have been strategic and instrumental in the execution of this meeting. Before we end officially, I do want to put up another poll everywhere for folks to respond to as you exit out of the meeting today. And to close out, I would like to hear from you, or we would like to hear from you all, what meeting discussion or topics resonated with you today. We'll leave the poll open for about another 3 minutes, and then we'll close out the webinar. Thank you again for joining us, and I hope that you have an enjoyable evening.